Good morning, student. Today we want to discuss a very important topic commonly asked in the Bible table and also come as a theory question. Explain why polyphagia occurs in diabetes mellitus. Okay, so what is polyphagia? It is, as we all know, the excessive hunger and food consumption that is known as polyphagia. This is one of the cardinal features of diabetes mellitus, and it is like starving in a land of plenty. That means we know that in diabetes mellitus patient there is plenty of glucose in the blood. In spite of this fact, the patient suffers from polyphagia, that is excessive hunger. Now, to understand the pathophysiology of polyphagia in diabetes mellitus, you have to know about the regulation of feeding behavior. And one of the important regulatory center is hypothalamus. So where actually this hypothalamus it is present, as we all know, anatomically this hypothalamus it forms the lateral boundary of the third ventricle. So this blue part is a third ventricle. Hypothalamus it forms the lateral wall of this third ventricle. So here we can see another better view. So this is the hypothalamic sulcus. Okay, so this hypothalamic sulcus, the below hypothalamic sulcus, this wall is formed by the hypothalamus. Above the hypothalamic sulcus, it is formed by the medial surface of the thalamus. So this third ventricle lateral surface below hypothalamic sulcus, it is formed by hypothalamus. Above it, it is formed by the thalamus. What about the other wall? It has got the anterior wall. You can see here the anterior wall. The important structures are the anterior commissure. This you can see here. This is the anterior commissure. Anterior commissure. It forms the anterior border, and the anterior border of the fornix. The anterior border of the fornix. Okay, so this is the anterior border of the fornix. This one. So this is also formed by, this also forms the anterior wall of the third ventricle, and the third structure that contributes to the anterior wall is the lamina terminalis. So these three structures, anterior commissure, anterior column of fornix and the lamina terminalis, they will form the anterior wall of the third ventricle. What about the floor of it? We can see from this picture clearly. Floor is formed by the optic chiasma. So this is your optic chiasma. Then we have this infundibulum or the pituitary stalk. Okay, pituitary stalk and infundibulum, and this is, after that we have this mammillary body. So floor of the third ventricle is formed by the optic chiasma, infundibulum or the pituitary stalk, and the mammillary body, and also sometimes the posterior perforating substances in the tegmentum or the midbrain. So this is a midbrain. So posterior perforating substance of the midbrain, it also forms the floor of the third ventricle. Regarding the posterior wall of the third ventricle, it is formed by the pineal body. It is formed by the pineal body and the posterior commissure. It is formed by the pineal body and the posterior commissure. So actually hypothalamus is located at this area, just below you can see this hypothalamic sulcus. Okay. Now what actually this hypothalamus is? Hypothalamus is nothing but the conglomeration of several nuclei. So what are those nuclei? So we can divide the nuclei into majorly 3 or 4 groups. Okay, we can divide them. The anterior group of nuclei, you can see that here we have divided it into major 4 groups. So first come the anterior group, which includes the preoptic, which includes the supraoptic, which includes the paraventricular. So this is your preoptic, this is the supraoptic we can see, and this is the paraventricular. Okay, so and also the anterior group. So this portion it forms the anterior group of nuclei of the hypothalamus. Preoptic, then this supraoptic, then the paraventricular and the anterior group, and a very tiny suprachiasmatic nuclei is also included in this anterior group of nuclei. Now then we have the middle group of nuclei. What about this middle group? Middle group of nuclei, you can see that it has got the tuberal group, then the tuberal region, so it has got the tuberal group, then it has got the arcuate nucleus, it has the arcuate nucleus and ventromedial and dorsomedial nucleus. So these are your, this is your dorsomedial nucleus and this is your ventromedial nucleus. Then you have the arcuate nucleus and this tuberal nucleus. So all these are included into the middle group. Regarding the posterior group, it is the mammillary region, as we have seen in the last slide. The posterior wall is formed by the mammillary body. So we have the supramammillary, mammillary and post-hypothalamic nucleus. Supramammillary, mammillary and posterior hypothalamic nucleus. In addition to that, in the lateral zone we have the lateral preoptic and lateral hypothalamic nuclei. So we can see this will give a very better view. This will give a better view. So here is your anterior group. Anterior group, we can see it is the preoptic, we have the anterior nucleus, then the supraoptic, then we have the paraventricular nucleus, all, and the suprachiasmatic nucleus. So all these are included in the anterior group. Then in between we have the middle group, and this middle group we can see this is your arcuate nucleus, this is the ventromedial nucleus, this is the dorsomedial nucleus, and also the tuberal nucleus are also included into this group, this middle one. Okay, arcuate and all this. And regarding the posterior group we have the supramammillary, this is a mammillary nucleus, then we have the supramammillary nucleus and the posterior hypothalamic nucleus. Okay, and in the lateral group we have the lateral hypothalamic nucleus. We will have the lateral hypothalamic nucleus. Regarding the functions of this nucleus, we want to highlight in this regard, especially in the feeding behavior, we want to highlight the functions of three nucleus. One is the arcuate nucleus, another is the lateral nucleus, another is your ventromedial nucleus. This lateral and ventromedial nuclei of the hypothalamus, it is very, very important. The lateral nucleus, you will see that it is known as the feeding center. The lateral nucleus is known as the feeding center. Okay, so if you stimulate the lateral nucleus, there will be hunger. So stimulation of lateral nucleus, it will induce eating. Okay, and destruction will cause the starvation. Whereas the ventromedial nucleus, you will see the ventromedial nucleus is known as the satiety center. And we know that if it is stimulated, there will be fullness, no hunger, and if it is destroyed, there will be severe hunger or polyphagia. Okay, so lateral nucleus is the feeding center and the ventromedial nucleus is the satiety center. And another important nucleus in this feeding behavior is your arcuate nucleus. This arcuate nucleus, it produces, actually it regulates this feeding center and the satiety center. How? That we will see in the next slide. So these are the three regions of our interest. Now come to the start with this arcuate nucleus. In the arcuate nucleus, there are two hunger regulatory neurons. You can see one is, this is known as AGRP, is the agouti related peptide. This is known as the agouti related peptide. Another region is there, that is the POMC neurons. These are also known as, POMC means pro-opiomelanocortin neurons. Pro-opiomelanocortin neurons. So we have two regulatory neurons located at the arcuate nucleus. One is AGRP neuron, agouti related peptide or protein. Another is the probiomelanocortin neurons. What are their functions? Now, these agouti related peptide neurons, they drive hunger. That means they are orexigenic. So, stimulating AGRP neurons, there will be hunger. And the opposite effect will be produced by this POMC neuron. So, they will promote satiety. Okay. Now, if we look into actually what happens, this POMC, it see that this POMC will release what? POMC will release some substances known as alpha MSH, which are anorexigenic. That means it will cause anorexia. So it has got a profound positive effect on what? On the satiety center. Where actually this satiety center is situated? It is situated at the ventromedial nucleus of the hypothalamus. So this is your S, okay, satiety center. So this POMC will reduce alpha MSH, which will stimulate the satiety center. Whereas this agouti related peptide, this neuron will release either neuropeptide Y or GABA, and it will inhibit this satiety center. So this POMC and AGRP, their action is opposite. POMC stimulates satiety, AGRP stimulates hunger. So POMC stimulates the satiety center, AGRP inhibits this satiety center. Now, what is the interrelationship between the satiety center and the feeding center? So, ventromedial nucleus, it is the satiety center, fullness, and the hungry center or the hunger center is the lateral nucleus. So, and we know that the POMC actually will give alpha MSH, which is positive neurotransmitter to this satiety neurons, whereas AGRP will release either neuropeptide Y or GABA that will inhibit the satiety center. Now, we know that in the glucostatic theory of uh, feeding behavior, we see that if there is after food, when the glucose concentration is raised in our body, so there will be increased insulin, and this raised glucose concentration will actually stimulate the satiety center and we will feel the fullness. Okay. And when there is lack of glucose in our body, so there will be no insulin, and it will actually stimulate our hunger center. Okay. So in this way, a balance is maintained in our body. Now, how actually this feeding center and the satiety center, they regulate each other. Okay, we'll see that the actual active center is your satiety center at the ventromedial hypothalamus. Okay, it gives a negative tone or tonic stimulation on this feeding center. So it is always negative on the feeding center. It tries to suppress the feeding center. Okay. Now this satiety center at the ventromedial hypothalamus, it is actually insulin sensitive. Okay, you will see that almost all cells in the brain, the entry of glucose into the brain cell, it is insulin independent. Only exception, it is this satiety center at the ventromedial hypothalamus. So they are insulin sensitive. And you know, in diabetes mellitus type 2, there is high glucose, there is high insulin, but there is insulin resistance. And in type 1, there is lack of insulin. Okay. So in both the cases, due to absence or due to resistance of insulin, the entry of glucose into this satiety center, it is reduced. Okay. So lack of glucose entry into the ventromedial hypothalamus means it will reduce the activity of satiety center. What is its activity? Its activity is to suppress the feeding center. So as a result, decreased activity of the satiety center removes its that is inhibitory effect on the feeding center in diabetes mellitus. So there will be unopposed hyperactivity of this feeding center, and this will result in polyphagia. So polyphagia in diabetes mellitus, it is due to the inhibition of the inhibitory effect of satiety center on the feeding center.